I'm Tamara, and this is TELUS Talks with Tamara Taggart. We're bringing together experts, thinkers, and leaders, busting myths, sharing stories, and staying connected when Canadians need it the most. We're having unexpected conversations for unprecedented times. Hi, Dr. Henry. Thank you so much for taking some time to talk to us today. I really appreciate it.
Well, thank you.
Okay, so I have been reading your book, Soap and Water and Common Sense. I bought it for $10 on my iPad, and it's been great. I've actually learned a lot about viruses and bacterias. I only wish I would have read this a long time ago. So you've been studying the transmission of diseases for decades. And, it was really interesting to hear what you had to say in your book about SARS and Ebola and AIDS. And now we're dealing with COVID-19. How is this virus different than other ones that you have been working with or tracking down?
Well, it's a virus, and so it does behave like a lot of other viruses, but each of them has its unique characteristics. And when I think of this one, when it first came out, having had experience with SARS, my first concern was that it was going to be as deadly as SARS was. And then my second concern was, is it going to spread more easily or less easily? And so really what we've come to learn over the last few months is that it is a virus that is spread through respiratory droplets in the same way that other coronaviruses are, and influenza and SARS. It's not as lethal as SARS was, which is a good thing, but it's far more infectious, and it's not as infectious as influenza, for example. It doesn't spread quite as easily as influenza, but it's far more lethal than influenza. So it's a very challenging virus to contain and to manage.
This is your home province, and now you're in charge of all of our safety when it comes to this virus. I don't think, could you have imagined this happening?
Sort of. I've spent a lot of time working on pandemic influenza planning, and we've talked about things, scenarios, and we have a Canadian pandemic influenza plan, and it has these scenarios, and one of the scenarios is just this. But, we did this thinking of influenza. And so the nice thing about influenza is we have a well-established mechanism for developing vaccines. We have some treatments. And that is the biggest challenge with this virus. So while we thought we might have to do what we call social distancing measures or public health measures, non-pharmaceutical interventions, we have all these fancy names for them, I didn't ever really think that I would have to impose things like travel restrictions and canceling in-classroom schooling and, the whole really important distancing that we're doing and the impact it's having on our entire society and, of course, on economies and society around the world. It was and continues to be very surreal in some ways.
Mm-hmm. Yeah, surreal is how I've been describing it. For me, as a parent and, somebody who needs to earn a living. And you're right, it is affecting everybody in different ways. But for people that don't understand what your exact role is, so you are the one that you're making the calls. You're saying schools need to shut down. You're saying, no parks are open. So maybe you can explain to somebody who isn't quite clear on what your responsibility is.
Well, I have to say it's not just me, as we always say in public health. It's a team sport. So there are many wise people that advise me. We work on these things together. We look at the data. We look at the science behind it. And, I have to say there are some very strong leaders in our healthcare system as well who have been very involved in this. And so it's my advice in some ways, in some instances, and it is direction in others. So I'm the provincial health officer here in British Columbia. Across Canada, we call them different things, but it's essentially the chief medical officer of health. So it's not a political position or an appointed position. It is something that is held by, you have to have a medical degree, you have to have experience. And my predecessor, Dr. Perry Kendall, was in this job for many years, and I learned tremendous amounts from him. And then when he retired, I was appointed to the position based on my experience and who I was. But it is a challenging, because I have an independent reporting role to the public on the health of the population, and it is there's a piece of legislation in BC. It's called the Public Health Act, but it's the same across the country. Each province has a Public Health Act that gives me authorities to take specific actions, but all to protect the health of the public. So it needs to be an action that is going to make a difference, and that it has evidence behind it. So yes, I have been providing the advice to government about the things we need to do around the healthcare system. And some of it is orders that I have given provincially to enact certain parts of the response that I think are necessary things that we need to do to stop the transmission of this virus.
So, I mean, you are juggling a lot, and your team, how many people are on your team, would you say, about?
Well, I have a very small office, to be honest, but so there's just there's myself and two other physicians in this office, and we're all, of course, working full time on this now.
Yeah.
We have a strong public health system in the province, and so there's the chief medical health officers in each of the regional health authorities, and the medical health officers, the public health nurses, public health inspectors that we have across the province. We're a small but mighty team, I think.
Yes,
and
you are.
Been doing a ton of work.
Absolutely.
But we also have a very strong health system group that has been involved with this. And I can't say enough about the Deputy Minister, Stephen Brown, who's been the lead architect of the health system response and making sure we get everything organized across the health sector. And it involves everybody from the CEOs. Yeah.
So what about, let's talk a little bit just about, if we can go back to basics, because I know that you're also learning about, there's so much information coming in daily, and we're learning from other countries and other people that are experiencing this at the same time as us. Let's go back to the symptoms. What are the symptoms of COVID-19?
So this is a respiratory virus, which means it causes the same sort of things that we see with influenza, with the common cold. So cough, shortness of breath, fever is an important part. And we also see some of the sort of milder symptoms like sore throat, runny eyes, runny nose that sometimes happen with more on the common cold side, which makes it really tricky because it's very difficult, particularly in January, February, March, where we have a lot of other viruses circulating that cause these symptoms. It's really difficult to tell which is which. And especially early on, we know that particularly young, healthy people can have very mild symptoms with COVID-19. There is also, in some people, muscle aches and fatigue as well. And in a small number of people, particularly younger people, they may also have diarrhea as a symptom of COVID-19.
Right. So it's basically everything that we're used to having if we have a flu or a cold. So hard to tell. Exactly. There's a lot of talk about testing and why aren't we testing everybody? And we should just be testing every single person so we know. What's your response to that?
Yeah, so the testing is incredibly important, and how we use the testing is incredibly important. So it takes time to develop the test, and we're lucky here in BC and in Canada, we've had tests available since January, and our lab at the BC CDC has been amazing. It takes time to ramp that up. Part of the challenges we have are the global supply for the it's not just as easy as turning on a light switch and knowing yes or no. There's what we call reagents, so the solutions that things have to be in. There's the machines that need to be run. So anyway, it takes time to get all that. And we ramped up very quickly. We had a very low threshold for testing for a number of weeks. But once you start getting transmission in the community, it's really more about knowing where the outbreaks are, knowing where the health system is being affected, getting a sense of who needs to be in hospital and making sure people in hospital are identified quickly and early. So we switched our strategy to focus on where we needed to understand what was happening. But we didn't stop all of the community testing at all. We continued that. So we had a broader understanding, what we call surveillance of, how it was moving in our community. And now we're at the point where we're looking at switching back again and expanding who we're testing. So early on, it was really important to know that it was being introduced from other countries, particularly from China at the start, and then we knew Iran, and now, of course, Europe and the United States was large introductions from the United States. So it was really important for us to understand where it was coming from. Now we know that it's in most countries in the world. So travelers, we need them to self-isolate and to, if they have symptoms, and to stay away from others. So the action that we'll take is for them to stay away from others, to break those transmission chains. If they need to come in hospital, then absolutely we will test them. The other thing, though, that's really important about this test, it's not 100%. So it has what we call false positives. So it can't always tell if you have the virus, and it has false negatives, which is also a really important thing. And we've learned that the false negative rate, so the ability of the test to detect if you actually have this virus, is actually not as good as we need it to be. So it can't always tell early on, in particular, if you have the virus or not. The other thing that is really important is when somebody doesn't have any symptoms, the test is not very good. It's not valid at all. So going around and just testing everybody is not going to help us, because you might be negative right now, but you might develop symptoms in a few hours, and it could be related to this.
So what's the best thing that we can all do?
Yeah, so that's why we've put in place these really sweeping things. The best thing that we can do, all of us need to do right now, because we know this is in our community, is to put that distance between us. This is a respiratory virus, so it gets in droplets when we cough, when we sneeze. There's been a lot of talk about people spreading it before they have symptoms or when they don't have any symptoms at all. And for the most part, though, we know that particularly from what we've looked at here, where we do detailed investigations on every single case, it's when you have symptoms and when you're close to somebody that you're going to be transmitting this. So that's how we stop the transmission. Because we don't have a treatment and because we don't have a vaccine, we need to put that safe distance between us to stop us from passing it on to others.
Mm-hmm. So we're staying home if we can. We're self-isolating. We are staying 2 meters away from people. Most of us are.
And cleaning our hands.
And washing our hands. Is it important to even do that at home if you're self-isolating, to continue to wash your hands?
Absolutely. It's to protect those around you if you happen to have this, but it's important for everything that we do. And one of the reasons we talk so much about washing your hands, and people get very concerned that, if I touch something, I'm going to get infected with this. You don't get sick from this virus by having it on your hands. When you get sick from this virus is when you put your hands to your face, particularly your eyes or your nose, and the virus can then get into your nasal passages, the mucous membranes that have those receptors that allow the virus to get in. So that's why we need to be fastidious about cleaning our hands all the time. So you're not going to get it from touching the newspaper or from touching money or from touching things out in the bus railing or the elevator.
I think
button.
we're all figuring out how much we actually do touch our faces.
Exactly.
Because we've now been told not to touch them, and we touch them all the time. So this is, we have a long weekend coming up. I can't imagine that people would travel for fun this weekend with everything that's happening. I want to know about, travel restrictions for this weekend for people. And also, why aren't we just doing a full down 2-week lockdown? Like everything is done for 2 weeks.
Well, we are essentially doing that. But I think there's some really important balance we need to have in there. So for this weekend, absolutely. stay close to home, stay with your family. There's a number of religious celebrations coming up. Do it online, connect with people that you may not have connected with before. Find a way to have that community, but in a way that keeps the safe distance between us. And it really is about protecting our family, our friends. As I said, this is transmitted to people who you have close contact with, who you're indoors with, who you're spending time with. And we want to protect those people the most, particularly our elders and seniors. And I can't say enough about how important they are in our lives. And there are, the keepers of the memories and in many cases, the keepers of culture and language that we need to protect. So this is a good weekend to just connect, to think about those things, to think about your family, to think about your community, not to go traveling to summer cottages or homes on the Gulf Islands. Or our concern is we spent a lot of time protecting our healthcare system, but if we start going and inadvertently take this to a small community where there may not be the resources to look after you or to care for the people if they get sick, then we're going to undo all the important things that we've done. Mm-hmm. So now's the time to stay close and to stay home. Mm-hmm. I will say, though, that I think we need to find that balance. We need to make sure that people are able to get food, that they are able to get their medications, that you can fix your furnace if it breaks. There's things that our garbage is picked up. Really, if we lost the internet, we'd be in big trouble. Mm-hmm, so making sure we have all of those key things that allow us to continue to function, because it has been weeks, and it will be weeks more before we can get back to our usual.
Yeah,
but I also think
we
need to have the balance and the mental health balance. We know the risk is less when you're outdoors. This virus doesn't spread as well outdoors as most respiratory viruses don't spread as well outdoors. So I do think it's important for all of our sanity to be able to get out, to experience it, but to keep our distance from people, be respectful. It's not going out in groups and talking, because then we're getting close to each other again, and we can spread the virus. And then we can take it back to our family or to our elders or to people who are staying at home. But go out with your family, go for a walk, go for a bike ride, stay away from others, enjoy the sun and the beauty that we still have here.
So, how you mentioned it will be weeks more. When do you see life going back to normal? Do you see it yet? Do you see the end, or are you not there yet?
I think we have to rethink about what normal is going to be for a while. And, it's hard to fathom this. But this is a virus that is really lethal to older people, but we also know it's lethal to young people as well. And we've seen people in their 20s and 30s who are severely affected by this. We unfortunately had a tragic death in somebody in their 40s. So these are very real concerns. And we aren't going to be able to go back to the way things were a few months ago for the near future until we get enough immunity in our community. And that can either be because people have been infected, and we want to do that slowly over time so that we're not overwhelming our system and we're protecting the people who are more likely to have severe illness, or until we have a vaccine. The vaccine, there's a lot of work been going on around the world to try and develop a vaccine, and that'll be really important. I do think and I hope that we're going to get a bit of a reprieve, and we're looking right now about, what do we do to allow us to get back to some semblance of normalcy, with still being able to protect people and monitor in case this flares up again. And so those are the questions that are that we're all tackling right now. How do we do that in a way that protects people still?
And if there, when there is a vaccine, how do you see that going? Is that something where a vaccine's available and it will be voluntary to get it, or a vaccine's available, it's a mass vaccination, it's mandatory? I mean, I still have my smallpox, vaccination from that I got when I was 1. So is it similar, or is this a whole different beast?
I think I do not believe in mandatory immunization. I think most people will be wanting a vaccine to protect themselves, but also to protect their families and to protect the seniors in their lives. Because even though most of us, particularly younger people, most of them will have a very mild illness with this. It's those around us, our families and our communities, that we need to protect as well. So I see this rolling out as a voluntary program, but a mass immunization program that as many people as possible get the vaccine as soon as they can.
Mm-hmm. Mm-hmm. Are we flattening the curve?
We are. The work that we are doing, what everybody is doing, is making a huge difference for us. We are still seeing people coming into hospital. We are still seeing people becoming quite ill with this in our intensive care units. And tragically, people are still dying from this here in BC. So we are making a difference, but we cannot let up now because we're in the middle of it right now. And we need to be really mindful of what's going on around us. The United States is still going through a lot of illness, and particularly in some of the larger cities in the eastern part and Mideast, and Washington State continues to have cases. We continue to have cases. We continue to watch what's happening in Ontario and Quebec. So we are by no means through this right now. But now's our time to continue to hold the line, to continue to have patience with each other, to have compassion, to be kind with those people who are helping us out when they make us stand in a lineup for 6 feet apart. We all need to just take a deep breath and know that we're going to get through this. But it's going to be some time now, and now's the time not to to continue to bend the curve and not bend the rules.
Mm-hmm, mm-hmm. A couple of things. When it comes to masks, a lot of talk about masks, and there's been some criticism of Dr. Tam, and which, I mean, it's. We're learning as we go. You're learning as you go. This and there's this big debate, I guess, if you will, about masks and whether to wear them or not wear them. Where are we at with masks in BC?
Yeah, as you say, we're learning as we go. And we know that medical masks in the community are really a no-go right now. We need to keep medical masks, and particularly what we call respirators, or the N95 respirators. We need those in our healthcare system. And there is still a global shortage of these really important personal protective equipment in the healthcare system. So all of us are unequivocal on that. No medical masks in the community. Where things have changed a little bit is more evidence that there may be transmission from people, again, in close settings. When early on when I have symptoms, or in the days or the day before I start to have symptoms, and that some people in particular have a very high viral load. So a lot of virus in their saliva just before they get symptoms. And there's no way to tell which person is that person and which person isn't going to shed the virus until they definitely have a cough. So what has the sort of consensus, I guess, is that it probably doesn't hurt to wear a non-medical mask if you need to be out in the community and for short periods of time may not be able to maintain our 6-foot distance between people, or 1 to 2 meters between people. So if you need to go on transportation to go to work, if you're at the grocery store and you may be passing somebody, it's a way of keeping your droplets in. So it's not going to protect you from getting it. As far as we know, there's no evidence it'll protect you from somebody else coughing in your face. But, we hope that people aren't doing that as well. But it does keep your droplets from spreading out and from getting contaminating surfaces. And if people aren't as good at washing their hands, for example. So I liken it to covering your cough, like using a tissue and cleaning your hands, or coughing into your elbow. For short periods of time, if you need to be out or be in contact with others, then wearing a non-medical cloth mask can probably help keep your droplets in.
Right. In your book, you said something that really it's really stuck with me. It's complacency can be costly and deadly. And I mean, it's true. So were we complacent? I mean, I feel like I was. I never imagined in my day-to-day life that this would be happening right now in BC and Canada, around the world. And, yes, I'm aware of SARS and H1N1 and AIDS and all the ones in history that we know about too. But none of it seemed real to me. Mm-hmm. So I'm not talking about you being complacent, scientists being complacent, but do you think that worldwide we were complacent about this virus or other viruses?
I think yes and no. It is so challenging, and having lived through Ebola and SARS, and it does strike that sense of fear in people. But then, we do get a little complacent. There was a lot of talk around hand hygiene, around building up our capacity to manage outbreaks of new viruses and pandemics after the SARS outbreak. And, public health had been, it's easy when you have the tyranny of the urgent with all the needs in our healthcare system to whittle away at prevention. And public health is all about prevention. And yes, we got a big boost after SARS, but then it was whittled away again. And then we had the H1N1 pandemic, and it wasn't as severe as other pandemics, although, don't get me wrong, it really did create quite a lot of young people becoming ill. And I often say if the Olympics in Vancouver had been in November or October of that year, we would have had to cancel or postpone them because all of our ICU beds were full of young people on ventilators because of H1N1. But we, as a global community, it wasn't that bad a pandemic. So we did get a little complacent after that. I think people as well got a little complacent about immunization. And that's one of the things that we saw was immunization rates for influenza, but also for things like measles and whooping cough and all those other protections that we had. People didn't see these very often. So there was a sense of we don't need those protections anymore. And certainly public health and the role that we play in the community and keeping people safe and trying to do prevention. So, yeah, some of our pandemic stockpiles had expired and hadn't been replaced. And
so how do we learn from this? How do we learn from COVID-19 so that we aren't complacent ever again?
I mean, as you say, it doesn't seem real in many ways that this is happening to us around the world. And I can't imagine that we will reset our world to a place where complacency about this type of thing could ever happen, at least in my lifetime. But you never know. I mean, I thought that after SARS as well, that we had, particularly in Canada, a real wake-up call. But there are many things that overtake that. I hope that some of the positive unintended consequences will last through this. And there are many things that people are telling me that are positive that are coming out of us. A sense of spending time with family, of appreciating time in a different way. We had a call yesterday with a number of religious leaders of faith communities across the province, and many of them were saying that their online offerings and connections had dramatically increased the number of people that were involved from hundreds to thousands of people who found them online.
Right.
We can't, the unintended negative consequences on our economy and on people's health can't be underestimated either. But
definitely, I've been thinking. Yeah, I have a son with a disability, and so people, disabled people are of deep concern for me. And, we mention seniors all the time and long-term resident homes. And, we know people with disabilities, most of them live in poverty. They're in group homes. And I'm, in that community, there's a lot of concern about many things. But do you think that I can't help but think myself that poverty is an underlying health condition, really.
This is something that we talk about a lot in public health, and we call it the social determinants of health. And probably the biggest determinant is poverty. It's education. It's the things that you need to have as a society. One of the things we talk about are minimum basic income, and there's been some experiments, if you will, in Canada around that wax and wane according to political will. So I hope that we can start looking at what are the things that keep us as a society healthy, and how can we support that. And these are things that we talk about with the overdose crises that we've been living through the last few years. The importance of people who use drugs often use it to support themselves through pain, whether that's emotional pain, whether it's pain from not having enough to eat, or the childhood that they went through. So all of those things that we do to support people and the more marginalized people in our society are the things that are going to help us through health as well. So I absolutely agree with you. I think we need to rethink, how do we keep people safe? And some of that is around housing, making sure people have access to food. And it's certainly not lost on me through this crisis that food security has become a challenge. People who don't have access to bank cards are having difficulty buying food. Even our food banks are challenged to provide food to people in a way that's safe. And the economic impacts that we're going to be seeing in the coming years, we need to recognize and support those who are the most disadvantaged, are the ones who are going to suffer the most through this crisis as well.
Yeah, and I knew you felt that way, and it's so good to hear you say that, because it gets lost in everything else. There's just so much information out there and so many opinions, and to hear your voice, and I mean, to have somebody who is calm and smart and can really. It's common sense, right? Your book. Please read Dr. Henry's book. It's so good. So thank you for that. When do we know this is over? I know I asked you that, but I don't do we know it's over when the ICUs are empty, or do we know it's over? Not over, but I know there's a vaccine, but how do you know when the curve is flattened and enough that we can
we can start looking at. Yeah. And what things do we start with? Which are the ones? So there's a couple of things that we've been having discussions about this. What are the health pieces that we can get back to doing so that we're protecting those people who don't have COVID? The scheduled surgeries, the medical appointments that are so important. I think some of that is going to shift, that we're going to have a phase shift in the adoption of virtual care that's going to be of benefit for people. How do we monitor which businesses is it safer to start opening up again so that we can get the economy going again, because we know that makes a difference for people's health as well. Which are the things that are less risky, and so we need to look at the evidence about schools and kids coming together, and does that amplify it or not? And those are some of the things that we're doing now. What about being outdoors? How much risk is it compared to events indoors? How do we best manage workplaces to encourage continuous distancing, safe distancing? How do we protect smaller communities? So these are all the things we're talking about.
There's a lot.
How do we monitor travel? Because we know that it is still going to be a problem for many weeks to months in other parts of the world, and make sure that we can support people to self-isolate safely when they come back to our communities too. So those are all the questions that we're asking.
No kidding. And in your book, you mentioned things travel so fast now. We're modern. You can go from one country to another in a matter of hours, and then the virus moves with you. So there's so much to think about. Just as we wrap up, how are you taking care of yourself? I can't imagine that you have 2 seconds of time. Do you sleep at night? Because I don't, and I don't have
sleep
near the worry
very much, but I know. I do lay awake. I worry. I worry about the impacts of the things that we're doing, and it just, and I worry. I worry about young people. I worry about particularly teenagers who are at that transitional phase in their life, and we've just blown everything up. And I worry about kids who send me notes and say, "Do you think it'll be okay to have a real birthday party next month?" And it's like, maybe not next month. And how are they going to remember this? And how can we help young people with their anxieties that they sense, because they know enough to know that we're worried. How do we make it through? So things that I do actually meditate. I run, and I go early in the morning, and I find it's one of those things that helps me think, helps me stay a little bit connected to myself and the world out there. So I do short runs these days, but
yes.
It helps a lot. And I connect with family, and I'm very lucky. I have close sisters. I have, family, and we've talked in ways and times that we never have before. And, appreciate those things.
And you have a new foreword to your book. I'm not getting paid to plug your book. I know that, but it is very good. But you do have a new foreword, and your sister, who's also a doctor, she interviews you.
No, she's not a doctor. She's a publisher, actually.
Oh, I thought it said Dr. Henry too. Well, I just promoted her to a doctor, but she interviews you, and you guys have a really good conversation about COVID, because this is a new foreword from March of 2020. So I really appreciated that sisterly conversation in the book.
My sister and I are very close in age, though we're completely opposite in many ways. And she's brilliant. She's in publishing. She's she came to spend some time with me during this, because I was quite stressed, as you can imagine. So it's been wonderful having that connection. And as part of this, she, when the House of Anansi said they wanted to re-release the book, she said, well, let me put together something that would give you a sense of what's happening right now. So I was really grateful for her for that.
I'm grateful for it too, because it really helped me wrap my head around everything that's happening right now. I can't thank you enough for taking the time out of your busy day to talk to us. I really appreciate it. Thank you for everything you do. My two daughters think you are a superhero, and we watch your press conferences, and it's a great way to keep them informed in a scientific way. So thank you for everything you're doing to keep us safe. I really appreciate your time, Dr. Henry.
Oh, thank you. And,
thank you.
We will get through this, and I can only hope that we'll keep the important things, and how we can stay connected with each other and stay calm and be kind to each other. And that will help us through.
I agree with you 100%. And for the latest medical updates, you can go to bccdc.ca. Thank you for joining us today, and be sure to join us here on TELUS Talks with Tamara Taggart every Tuesday and Thursday.